Hey everyone. We're going to talk today about a practical guide to assistive technology and the NDIS. So in today's webinar, we're going to look at what the NDIS mean by assistive tech, and we're going to look at the differences between low, mid, and high cost assistive technology, because mid cost is a new one, so it can be little bit confusing. And then we're going to look a bit at the steps of how to get assistive technology, and if you have assistive technology and you need it replaced or repaired, what does that look like? And then we've got a few questions at the end. So before I start today, I just want to acknowledge the traditional custodians of the land on which we meet today and pay my respects to the elders past, present, and emerging. I extend that respect to the Aboriginal and Torres Strait Islander people here today. So what is assistive technology when it comes to NDIS? So it essentially is equipment or devices that help an individual to do things they can't do as a result of their disability. So it helps to, when someone has a barrier due to their disability, and it means that they can't access a room or the community, or engage in an activity in, say, the kitchen, so cooking or something like that, or showering in the bathroom, then the NDIA can put funding into an individual's plan to fund equipment that is recommended by a allied health professional or a nurse to help that person independently participate safely in that activity. So all NDIS supports, and this includes assistive technology, must meet the reasonable and necessary criteria, which we've talked about so many times, but we'll touch on it again a bit later in today's webinar. And the NDIA cannot fund assistive tech items that are more appropriately funded by another government service, for example, health or education. So when it comes to if you or your loved one needs a piece of equipment in hospital or in school or university or even work, there is a bit of a crossover there. So the NDIA would push back and say that that is more appropriately funded by health or education or by the workplace. So not always, but a lot of the time it is. So there are three different budgets in an NDIS plan, but for assistive technology, it can come out of two different budgets. So a person's core budget is where they can have funding in there for low cost assistive technology. This is up to $1,500 per item. It needs to be low cost and low risk. That we'll clarify. I'll clarify the risk, what's identified as low risk a bit later on. But in terms of cost, it's anything $1,500 and below. When it comes to the core budget, though, if the LAC when you're having your meeting says, oh, I'm going to build in $500 into the core budget for your assistive technology, which can include minor repairs of equipment as well. If you want to use more of your core budget for that, you absolutely can, because there's flexibility within that budget. So you're not bound by the $500, but what happens is it means that you are then eating into, say, your support worker budget or another part. If you've got continence aids and stuff, then it's eating into those things. So it's still being taken from a budget, but it is you do have flexibility to go over that amount that's initially built in for a piece of equipment, as long as it meets the reasonable and necessary criteria. And then the other budget that assistive technology can be funding can be found in is the capital budget. And that's where the funding for mid-cost, so that's between $1,500 and $15,000, and high cost, that's anything over $15,000, is found. So if you have, and we'll talk more about this, but if you have requested a piece of equipment, and we'll talk about how to do that. But and you'll see in the plan, when it comes to the low cost stuff, that's pretty simply in the plan just there. But when it comes to the mid and high cost stuff, the mid cost, you'll get an amount and it will be sitting there and you can use that for mid cost items. When it comes to your higher cost items, it can either be there if you've submitted a quote and an assessment, so it's all good to go, it will be built in the plan. But if you haven't submitted a quote and an assessment, but you're requesting it, they may build it in behind the plan, so it will sit there, and it might be it might be typed on the left-hand side in the box. It might say funding in here for assistive technology, quote required. So it won't already be in there, and you won't see that amount, but it will be built behind the plan. So once you submit the quote, then it will get the funding will be paid to the provider, and you'll get that piece of equipment. So they're the two budgets that it can be found under. So as we know, the NDIA are constantly working to improve and sustain the scheme. And so they talk about the vision for improved assistive technology. And when they talk about that, they talk about informing participants to optimize the use of AT to pursue home and living goals. So this is a big one. And they are saying now, when it comes to short-term specialist disability accommodation, home modifications, even SIL and ILO options, like all the home and living options now, what they are also looking at is how can we include in a person's plan assistive technology that is going to replace an individual, like a funded support worker, doing that for them so that they can do it independently. So they are really looking to explore that. That's obviously going to, number one, reduce costs for the agency, but it's also going to increase independence for the individual. So when you're looking at assistive technology, and if you're exploring housing options, then that is something that your OT or your allied health team needs to really consider. Is there any assistive technology here that I can use that will mean that I can do this task more independently and don't need a support worker for that time? So whether that's in the kitchen, in the bathroom, whether that's just accessing the community or going out in the garden, something like that. So that's a big thing that the NDIA are really pushing. They're trying to improve processes to reduce the delays. And if you've gone through assistive technology over the years with the NDIA, there have been significant periods of delay. It has improved, and since they've added the mid-cost, it has improved a lot more in terms of the mid-cost money is in there, and you've got a bit more flexibility with it to get things approved quicker. And so you don't have to go through the big getting the AT assessment and quote, sending it to the agency, and by the time the agency get around to it, the quote's expired and you have to get another one, and it just goes around and around like that. And so that's really awesome that they are reducing those delays and working on ways to do that. They want to look at supply and pricing of equipment. So again, if you're familiar with assistive technology and the NDIS, there's a lot of providers that really hike up the prices when it comes to NDIS funded participants accessing it. So they're reviewing that and looking at how they can reduce those costs so there's consistency across across all of the providers. They're looking to reduce reoccurring costs. So rather than having constant replacements, making sure that there's enough for repairs and maintenance. And if that person's equipment is repaired and maintained, then there's less replacement of it through the lifetime of the piece of equipment. In saying that, never sit with a piece of equipment if it's not working and not safe. Like, absolutely, the NDIA will pay for a replacement if that's what's needed. And want to make sure that the AT provided is working, it's being used, and it's delivering good outcomes. So, and if not, like, how are they assessing that, and is that the most efficient way of the person accessing that, completing that task? So they're parts of the NDIA's vision. So now we're going to look a little bit at the risk categories. So I mentioned just a couple of slides ago that the costs, so low cost, mid cost, and high cost. There's also low risk and high risk. So the NDIA used 2 product risk categories to assess the complexity of a person's AT needs. It's important to understand because the higher risk products need more assessment and justification, and that takes longer to get funded for an individual, which can impact on whether they choose that item. So, or one that can be funded quicker. So, and also it causes payment delays to the provider, which the provider doesn't like, understandably. So if you're looking at the product risk, then you and you're kind of just trying to decide on a piece of equipment, always go with the one that is recommended by the therapist, and is going to be the best outcome for you, even if it's a bit more time, like takes a bit more time to get approved. But if there is a lower cost, lower risk option, then that's going to be a lot quicker for you or your loved one to get funded. So low cost AT products are unlikely to cause harm in day-to-day life. They're available for trial and can be purchased in retail stores or sort of those off-the-shelf items, easy to set up and safely use without professional advice. So they're not modified to the person. They're really things that you can get in a chemist or online that are that are pretty sort of easy, but they must still be disability specific. And so when it comes to something like a weighted blanket, which is something that a lot of people ask for, that's considered to be higher risk because of it can suffocate and things like that have been in the news. And so they would consider that higher risk, but they also consider it higher risk because it isn't completely evidence-based research that have said that it is this is actually going to be useful for this person's disability. We know that it helps to reduce that pressure, helps with calming the nervous system and stuff. And we know that a lot of people with, for example, autism experience a high amount of anxiety. So therefore, a weighted blanket can be useful for someone with autism who experiences a lot of anxiety, and that pressure can help them to relax the nervous system. So an occupational therapist may recommend it. It isn't. These items are a bit more difficult to get approved by the NDIA. And whether that you are if you're self-managed, you can obviously go out and purchase it. But if you're audited, then you need to be able to provide that justification. If you're plan managed, then the plan manager is looking at that, is looking at from a reasonable and necessary lens, but also is considering all of the things that the NDIA have said. So they are more likely to push it back and say that they're not going to fund it. If it's agency managed, again, if it goes to the agency and they don't agree that it is found to be reasonable and necessary, they will not process that payment. So they're even though they're low cost items, they're higher risk. So there's a bit of a imbalance there, and you might find that there's pushback because of that. Higher risk AT products, maybe one or all of the following. So they're complex. So like a power wheelchair, so they need to be modified. There needs to be a lot of assessment, a lot of trials, a lot of sort of modifying to that individual to ensure that it's safe for that person, that it's comfortable for that person, that it works effectively for that person and that person's needs. It's known to have caused harm. It might be if it's used for a restrictive practice. So things like restraints and stuff, which don't actually cost very much money, but they are higher risk and they're used for as a restrictive practice, they would be considered a high risk item, or if they require professional advice, setup, or training for safe use. So like I said, there can be that imbalance with risk. And so if you have pushback from a provider, from a plan manager or from the NDIA to fund it, or even at the stage of speaking with an LAC or planner to get it built into the plan, that's where you might see it. So they might ask for further information from allied health professional, and that either will come in the form of a full AT assessment report, which high cost, high risk items require, or they might not need a full AT assessment, but they might need quite a strong supporting letter to say that it's appropriate, and a quote to like specifically show which one is appropriate. So for like when it comes to equipment, the other thing to consider, and this is something to discuss with your allied health professional, or nurse, and there are lots of factors that come into this. So it could be the age of the participant, it could be the participant's needs are changing, whether they're improving or declining, that purchasing the piece of equipment might not be the most appropriate. And so then we would look at renting or borrowing them. And so this can also be funded through the NDIA, and so through a person's NDIS plan. And when it comes to renting, you can also have equipment in you might have it built in behind the plan that the person needs a power wheelchair, and you've identified that, but in the interim, they need a rental, or they need a rental for the trial, or to find out which one it is. So you can ask for rental equipment, not just for like if you want to rent it ongoing, but if you need it for a short period of time. So that is also something that can be funded, and it's also something to consider. And so when it comes to the funding of a piece of equipment, there are, which I've just touched on, but I'll go over it again. There are different processes for low, mid, and high cost items. So when it's rental, it comes under consumables under the core budget, and so that can be put in there, and can be used as needed. When it comes to actual items that you're purchasing, low cost and low risk assistive tech, so under $1,500 per item, it just requires a quote and a recommendation letter from an allied health professional, and the approval process, whether that is through the agency or through a plan manager, is fairly quick if you have money in your core budget, and that it's been acknowledged that you're going to purchase it for some consumables. If not, then it needs to go through the review process, which is putting in for a change of situation, and you can request either a plan variation or if there are more things that you want to review, then you would ask for a full plan reassessment. But in the form that either you or your support coordinator or a loved one can complete, it will ask you to tick whether you want a plan variation, which is just a minor change, or it's just changing one or two parts of the plan, or if you want to review the whole plan, and that is and all the categories, and that would be a full plan reassessment. But if there's money in, say there's money in core for consumables and they've put in, say, $500 in there, and you've spent the $500 on something, on a piece of equipment, but then the OT recommends a further piece of equipment and you've still got core money in there, you can purchase it without going through a plan variation if you're happy with using your plan, your core budget on that, and eating into support worker hours or other things. When it comes to mid-cost assistive technology, so between $1,500 and $15,000 per item, it also requires a quote and recommendation letter, and the approval process is now very fast with that. So that is it, like being that the top of that is $15,000. If you have $15,000 built into your capital budget, and you might have a list of things that you want to purchase, it doesn't need much to get approved, and it's sitting in there. And so you don't need to go back through the agency or anything. Again, if it's not in there, that's when it takes a bit longer, because you have to go through the review process of the plan to add the funding in there. But if you've got the funding in there, it's quite quick. High cost and high risk assistive technology, so anything over $15,000. It requires a full assistive tech assessment, quote, and approval by the NDIA, and it can take up to 3 months to approve. So in the interim, if you need a rental or if you need some other piece of equipment to carry you over and you don't have that funding in the plan for, say, mid or low cost items, then you will need to go through the process of a plan variation to ask for additional money for that. And at the same time, you can submit the AT request for the bigger item that you're waiting on, but you know that a process is going to take some time. So here is just a table that is from the NDIS website, and it talks about low cost technology products, high risk assistive technology products, and it just gives a bit more of a description and some examples. So this is not like, this is just a few examples. There's so many examples, but here are just a few. So products you or your family can choose that need very little advice or setup from assistive tech advisors to use them safely. That includes like physios, nurse, OT. There's a low risk of causing harm when used in daily living environments. Some examples: non-slip bath mat, knives and forks. It doesn't specify here, but they're adapted knives and forks. So things that are, so not just your regular knives and forks, they're adaptive cutlery. Large print labels, a shower stool or chair, handrails, portable ramps, mainstream computer technology. That falls under mainstream computer technology, so iPads falls under low risk AT products. But the process of getting they won't just fund an iPad, especially now that COVID's over. During COVID, they were funding them very easily because people were needing Zoom. Typically, they wouldn't usually be funded unless it is for AAC, so as a communication device, or for a communication program, or it might be for someone who is hearing impaired. If it is for another reason, then there needs to be quite a strong justification provided there for it to be funded, and without, it will be knocked back. And if you purchase it self-managed and you get audited, there is a high risk of you having to pay it back. So yeah, iPads are a bit tricky these days. Higher risk assistive tech products, like we've said, they need advice, and they for good selection and good outcomes. And the NDIA also relies on information from the NDIS Quality and Safeguards Commission to determine those high risk. So this could be bed sticks and other transfer aids, items that potentially restrict voluntary movement. This includes bed rails, covers, weighted blankets, powered devices for magnification, hearing, etc., mobility and postural support or correction devices, motor vehicle adaptations, pressure care devices, beds adjustable while occupied, prosthetics, orthotics, devices to support breathing. So even though they might be under the $15,000, so they might not be over, which a lot of those things are definitely not over $15,000, but they're a higher risk item. So they're going to require more assessment and more justification for the NDIS to approve or for a plan manager to approve. So how do we get assistive technology in the plan? There are a few ways to get assistive tech in your plan. So you can talk to your LAC or planner at the planning meeting about getting assistive technology in your plan and what that might be. Depending on what it is, they might put some funding in there for equipment, or they might put money in the plan for you to explore it. And this can be for further assessment or for an OT or a continence nurse or someone to write a recommendation letter and to explore which items. So you might go to the planning meeting and say, I need a communication device, or I need support with my hearing, or I need support with my vision, but I'm not sure what pieces of equipment I need, or I need support with my mobility, but I'm not sure what piece of equipment. So they might say, okay, well, we're going to build in some money for you to see an OT or a continence nurse or a hearing specialist or a physio to identify what it is. And then we're going to put some money in your core consumables budget for that. They might build in some mid-cost assistive technology money if they're convinced enough that that is reasonable, but that isn't always put in. So you might need to then, once you get the plan, it might be a couple of steps. So you might then need to get the plan back, and then there'll be money for you to explore the options. Once you've got the options, the recommendations letter, the quote, you go back to the NDIA with a change of situation, and then you say that these are the things I need, and this is the people who are backing it up, and then they can build in the money for you. So it can be a bit of a process, but if you have got an NDIS plan and you're just wanting a change in equipment, then I would say, if you can and you have the funding before the reassessment meeting, try and have the recommendation letters, the quotes and stuff ready, and that will make the process a lot quicker. The assessment, the AT assessment, if you can do that, if you've got the funding for it, then you can do that, but it might be a bit more, it's going to be a bit more expensive, so it might be something that you need more funding to then do. And then if once you've got the assessment reports and stuff, then you can request a plan variation through a change of circumstance. But if you want to review the whole plan, you need to specify that it's plan reassessment. Otherwise, they will put in you'll get it. Say you want to do a plan variation and you submit a quote and a report to say that this is the piece of equipment that you need. The NDIA will vary the plan by adding the funding for the assistive technology, but they're not going to change anything else in the plan. So if you want other things in the plan changed, you need to specify that, and that needs to then be reviewed. Otherwise, it won't be touched. You'll get a new plan with new plan dates, and the funding will be replenished, but it won't be changed. So when it comes to any support, and we talk about this so much, it must meet the reasonable and necessary criteria. So just going through it one more time. So for support to be considered, including assistive technology, whether it's low cost, mid cost, or high cost, it always needs to meet all of the funding criteria before it can be included in the plan. So it needs to support, the support will help to achieve your goals. So you need to ensure that the goals in your NDIS plan are in line with the technology that you are requesting. And if not, it doesn't specifically have to specify assistive tech in your goal, but it does need to say, talk about independence or talk about access to the community, things like that, that if that is what the piece of equipment is going to help you to achieve. And so it can be really broad, and I do recommend your goals being broad, but it does need to ensure that it links to the goals. And if not, you need to, in that plan variation request or that reassessment request, you need to adjust the goals to ensure that it is in there. The next point is that the support will assist you to undertake activities to facilitate your social and economic participation by reducing the disability-specific barriers you are facing. So the NDIA are essentially going, okay, this piece of equipment is going to help that individual to be able to achieve something that they wouldn't typically be able to achieve due to the barriers they face as a direct result of the disability they've met access for. So it can't just be, so say someone has a psychosocial disability, they are not going to get equipment for their, poor, like their balance, because unless it can be linked. And so that is really important, that it is that it is all the disabilities that you that are functionally impacting you significantly, that you have met access for, because otherwise you won't receive funding for that. It represents value for money, so the support is reasonable relative to both the benefits achieved and the cost of alternative supports. So this balance needs to be had of, if we fund this, what's the value of that in terms of what are you going to achieve with this piece of equipment, and is there anything cheaper that can achieve the same thing? And so that value for money balance needs to happen. The support will be or likely to be effective and beneficial for you in regard to good practice. So it's reasoned clinically. So the therapists are saying that there's evidence that this piece of equipment has helped all these people in the past who have had the same barriers. And here's the evidence there. And clinically, we have assessed this person to say that this person has these same difficulties, and therefore we recommend and we suggest that it's likely, or it's going to be effective for this person as well. It's not guaranteed, nothing's guaranteed, but that it's likely to be. And then the support takes into account what's reasonable to expect from informal supports. So if it's someone over 18, then that informal support is not, like, it can be easily justified that it's not parental responsibility, and absolutely not responsibility of a partner, although the NDIA will try and push that as much as they can. And so, but that the informal support, it's not duplicating that the support that you are receiving informally. And that the support is most appropriately funded by the NDIS, which is something I said right at the beginning, and so that it's not most appropriately funded by health or education or by the person's workplace. So when it comes to education and when it comes to health and when it comes to work, if it's something that, like a power wheelchair that you use absolutely everywhere, then obviously the NDIS will fund it. If it's something specific to so say it's a vision program, or like to help someone to see the board at school or to see the board at uni, or if it is an adapted chair that a person can use at work, or some sort of adapted equipment that the person can do their work more effectively, whether that's schoolwork, uni work, or work. That is the responsibility of the education department or of the workplace to fund. When it comes to health, same thing, if it's something that's used everywhere, like a power wheelchair, NDIS will fund that. If it's something specific to health, like, so say someone's in hospital, then that is the responsibility of health to fund. Health and education and work will try and push it back, but then I would recommend sending the guide to mainstream and NDIS, mainstream versus NDIS supports to them, and ensuring that it is in line with the guidelines and obviously with legislation. So when it comes to evidence required to get 18 your plan, so if you've been recommended a piece of equipment by your allied health professional or a continence nurse or another professional, and you want to have that built into your plan without having to wait, you need evidence always, whether it's low, mid, or high cost, which I've said a few times through today's webinar, and it is really important. As always, it's an insurance scheme, so we need to always have evidence to back us up. So if it falls under, just going over it again, if it falls under low cost assistive technology, so under the $1,500, then a supporting letter is all that's required. However, the supporting letter must go into detail of how it meets the reasonable and necessary criteria. It's not necessary, but always helpful to get a quote. If the assistive technology falls under the mid cost, then it also needs a supporting letter. Depending on what the piece of equipment is, the provider may need to do a more comprehensive assessment to ensure the suitability of the piece of equipment. And it's also always helpful to have a quote, to get a quote. And I find that like the plan managers or the LAC or the planner, they will ask for quotes for the low cost and the mid cost stuff, because what that does is if they can see the supporting letter and the quote, that helps them to add it up and see how much they need to build into the plan for that person's equipment needs. If the quote's not there, it makes it very tricky to do that, and they're just guessing. If it falls under high cost, then it requires a full AT assessment and quote. And like I said, it takes quite a few months to do that. So if you need things in the interim, make sure that you specify that as well. So when it comes to repairs and maintenance, the NDIA will always include repairs and maintenance for equipment that you are currently using. It's just about letting them know what pieces of equipment you use, and just reminding them that you want minor and major repairs in there if that's suitable for, like, if the piece of equipment requires major repairs. You don't need an assessment, but you do need a quote to have the major repairs done. And so small repairs are like a tire puncture, and that's covered under core. And that will cover all of the minor repairs. And major repairs, like a regular service, that's always will be included in the capital budget under assistive technology. And then replacement. So the NDIA, like I said at the start, they will replace items. So if this might be, if it doesn't work, keeps breaking down, dangerous to keep using, or a child someone, it can be an adult as well, has outgrown it. It can be included in the capital assistive technology budget. And if it's like for like replacement, then even if it's a higher cost item, it may not need an assessment, but you can just like specify that, like ask what they need. It's up for discussion, but it typically doesn't need it if it's like for like, and there just needs to be a quote submitted, and that can be purchased. So I've included some helpful links here, and we'll also put some resources on the website, on the Fighting Chance website. Ali, do you want to talk to that a little bit?
Hello, Alessandra from Fighting Chance here. So yes, we will circulate this recording to everyone on the NDIS Education Series community, and we'll pop it up online and provide all of these links and some further resources in the email that goes out, and then you'll be able to access it on our website as well. So that's just fightingchance.org.au.
Thank you, Ali. That's all the slides for today. Ali, do you have any questions, or did I answer the questions that you had?
So we had one question submitted via email from a member of the community. I think it relates to some of what you were saying just now about the repairs and replacements, but it might just be helpful to go through it. So this person requested a new power wheelchair prior to the end of their plan. They had the recommendation, they had the quote, and they received the funding for it in their new plan. They received it in the capital supports budget, but the total capital supports budget was just the exact cost of the power wheelchair, even though the wording suggested that it also included repairs and maintenance. So where is their repairs and maintenance funding should it need any maintenance during that plan?
Yeah, so there should be money in the core budget for minor repairs, but when it comes to major repairs, there won't be funding built into it because the NDIA must see a quote. And so what needs to happen is they will acknowledge and definitely will do major repairs, but for that to happen, their quote needs to be submitted to the NDIA, and then that will be then paid to the provider directly. So the NDIA will pay it to the provider directly. And that will be because they don't know how much that repair is. When it comes to major repairs, that's always what will happen. So you won't see it visibly in the plan, but it will be sitting behind the plan. And so it's acknowledged in there on that left-hand side where it specifies in the description, it has been acknowledged, but it's just not visible. But when on the NDIA system, they can see it there. So then they're just waiting on that quote. So it's definitely in there.
Great. And does that apply to just this power wheelchair, or if they already have some assistive tech that they've purchased previously, does that repairs and maintenance budget enable for their previous tech as well?
Yeah, I would just make sure that it's specified when you go to your planning meetings or reassessment meetings, that you specify and really clearly outline to them what pieces of equipment you're currently using, because then they can make a note of that. But yes, you can get whatever equipment. If it needs major repairs, it will go through capital and it requires a quote. When it goes to minor repairs, it's still obviously a quote will be received by you guys, but it doesn't need to be. You can get the minor repairs through the core budget a lot easier because it's sort of just it's available there. So yeah, but that's for all equipment.
Amazing. And their final question was around kind of replacement, so that you've already spoken to that. But if AT is needed due to replacement wear and tear during the lifetime of the plan, if they need to go back and get another quote and supporting documentation for that, will they have to do a whole plan reassessment, or will the NDA just look at the assistive tech part?
They'll just look at the assistive tech part, so it becomes a plan variation, and they can do that can be a pretty quick process, but I would say always, just to make it clear to the NDIA. If you're doing a replacement of a piece of equipment, always fill in the change of situation form that's on the NDIS website. And then just tick the plan variation, and then you can write in the description that you need a like-for-like replacement. Attach that with the quote and submit that through the inquiries email. So inquiries@ndis.gov.au, and that will then that can be looked at and processed that way, because otherwise it can get a bit lost as to what you're asking for. If you're just submitting a quote, they'll be like, what is this? So so if it's in that form, then they know what you're talking about. You've got the quote there. You don't need an assessment. They might ask for further information depending on how the length of time of the piece of equipment, or if they didn't know anything about that piece of equipment. So they might ask for a bit more information, but typically a quote and that change of situation form, ticking the plan variation box, should be satisfactory for them to then vary the plan to add that piece of equipment in that needs to be replaced.
Amazing. Thank you, Alex.
No worries. Well, thanks everyone for listening, and thank you.